So thank you all for joining me today. We're going to be talking about alcohol and specifically its role in chronic illness. This is such a big topic, but it's one that we find is really timely as we enter in the darker days and in the holiday season that's upon us here. So we wanted to make sure that we shared something that was really clinically relevant for everyone. So my name is Dr. Molly Force, and I am the clinical director here at Prosper Natural Health. And my colleague, Dr. Rosalie de Lombaert, who's my fabulous team member here, is actually sick at home with laryngitis. So she's not going to be joining us today. So you guys just get me today. But she's helped me prepare this lovely talk today. And I'm hoping you guys all kind of leave this talk with some really good and useful information. This to us is really about empowerment of our community through education. And one of the tenets that we like to kind of pass forward is docere, which is the Latin root word of doctor, means to teach. So we feel like this is our community gift and service. And what we try to do is come up with topics each month that are really relevant to the kind of conversations we're having with our patients. And this one in particular is a topic that really touches so many of us. Alcohol is so part of our culture. Maybe it's part of our family dynamic or our social dynamic when we're interacting with friends. And it's something that is so very available to us. And it's something that really affects our body. And oftentimes, we find ourselves as clinician, like as in the clinic with patients, talking to them about how they're working so hard to stay healthy with their diet choices and staying hydrated and getting their exercise in. But when it comes down to things like drinking alcohol, that might be one of their major determining factors in what's going on with their health dysregulation and why they're feeling out of balance. So as naturopathic physicians, we really like to look at the whole picture. We're trained as primary care physicians, so we really like to get to the root cause of what's going on with our patients, but have a good understanding of the balance within the body. So today we're hoping to cover information, of course, about alcohol, how it's going to affect the body long term, specifically diseases that are linked to alcohol, things to be watching out for. And then there's this huge question, which is there an actual healthy amount of alcohol? And so I want to go over the data with you guys today. So this I just wanted to share. It's just an awesome infographic, kind of informational piece here that I think is so cool. What this research group did is they combined all this data on cancer in particular in regards to preventative things that we know from the medical literature in ways that we can prevent different types of cancer. And if you guys can see this here, we've got everything from lung cancer, breast cancer, bowel cancer, prostate cancer listed over here, and then some of these less common cancers listed out over here. And we've got these indications of different triggers that we know are lifestyle choices a lot of times, or different things that can happen to people, like certain things like infections and things like that, that can contribute to cancer risk. So we can see the overall weighting of these for all cancers. This is just so fascinating. The number one risk factor is tobacco use. Okay. So that's not a surprise to a lot of us. We know that smoking tobacco in particular can be very detrimental, and chewing it as well. The second one here is being overweight. Okay, so we know that can cause a cascade of inflammatory events. The next one is low fruit and veggie diet. Now, this is something we're constantly talking about with our patients, balancing that diet intake. You can see the fourth one on here is actually alcohol. So, and this says in the little infographic, even drinking any type of alcohol. So it doesn't seem to matter if it's a sugary mixed drink versus beer versus wine, any type of alcohol puts us at a higher risk for several of these cancers. You can see them, we put little red arrows so you can see like breast cancer in particular, bowel cancer, we've got esophageal cancer over here, and there are a few others that are going to be implicated as well, like liver cancer as well. So that was just such a powerful infographic that we found while we were doing this research, just looking at the most recent literature. And it was just so profound for us to kind of pause as doctors here at our clinic and say, oh my gosh, we need to really be having a very active dialogue with our patients about what they're doing in regards to their alcohol consumption, because it is a major contributing factor. Now, this is a list of the chronic conditions that are entirely attributed to alcohol. And a lot of this gets into some nitty gritty, more complex medical language, but you can see we've got some mental behavioral problems. Like, of course, if someone is acutely intoxicated, that could be a medical diagnosis. There are things like withdrawal states. We know that certain psych disorders, amnesic, where we're having forgetfulness syndrome as part of this. And then we get into these more degenerative nervous system components, problems where we have degeneration of certain organs that are very common. So we know we've got cardiomyopathies, heart problems that can be caused by alcohol. Of course, there's stomach lining inflammation that can be caused, like gastritis. And many of you know, of course, that there's liver disease. So things like alcoholic fatty liver changes. So that's changes where the hepatocytes, the cells of the liver, have actually changed to be mainly fat and no longer doing their important job facilitating as a filter agent for the body. We know that things like alcoholic cirrhosis, of course, is going to be entirely alcohol induced. And then things like acute pancreatitis, there's a type of that is only caused by alcohol. And then we also see down here changes, of course, to unborn fetuses as well. So for pregnancy, of course, there's implication there. So quite a bit of detrimental effects that can happen that are known to be caused solely by alcohol consumption. Then there's another group of changes that happen with chronic alcohol use, and these are considered to be component causes. So it means that alcohol is a component, it's a part of the problem, it's part of the triggering imbalance that happens for the body. And that's been documented in over 200 different conditions and diseases. So pretty darn substantial that we know that alcohol can absolutely have chronic, long-lasting, and negative effects. It can change the course of a disease action that may already be in effect for other reasons. So we also know that there are some studies that show that alcohol can be beneficial for certain things. So that's a conversation that we're going to be having today. Is there are some conditions that we know from the medical literature that alcohol can be very detrimental for, and then others where we see certain benefits. Now, drinking pattern and the quantity that's being consumed are also implicated. So typically with most disease states, we're seeing more alcohol that's ingested, the more risk we have involved in the damaging of our organ systems and our body. So that's, of course, important to mention. So when we're thinking about certain diseases having detrimental effect from alcohol, damaging effect from alcohol, and others actually having beneficial effect, we wanted to just show you this study that was done. Now, this was back already quite a few years ago in 2005. But this is a kind of cool one because they took the medical literature that was available and they divided it along all these different chronic disease states. And they said, look, so for all these cancers, especially the ones that involve tissues that are lined with your mucous membranes. So we're talking about the mouth, the nasopharynx, the esophageal area, stomach, all the way down through the colon and rectum. Those are all going to have damage. And that makes sense, right? You guys have felt whenever you've gotten alcohol in a cut or a scrape, you can feel how it burns. And that same burning and irritation is happening along those mucous membranes as we're drinking and ingesting alcohol into our body, which is essentially kind of like a big tube of a donut. Okay. So as far as other detrimental, very well documented, of course, liver cancer, and this is because of the massive impact that alcohol has on the liver. The liver is, of course, responsible for detoxifying the body and clearing those alcohol sugars from the bloodstream. And so it takes a big burden there. Now, we see as we go down this list of cancers, we see breast tissue here implicated, ovarian and prostate. So what we see here is that there is some evidence. If you look over here, it's kind of nice because they said, was this casual and insufficient evidence that needs a little bit more research, or is this pretty definitive? And then we get into some of the kind of odder, you're like, oh, this is interesting, that we see here for kidneys and urogenital not urogenital, just urinary cancers. Here we see that there may be some beneficial effects, but once again, this is just with this insufficient kind of causal evidence seen in the medical literature. Same thing with Hodgkin's and non-Hodgkin's lymphomas. And we're going to be talking about the implication for the immune system for alcohol as we go through the talk today. So this will kind of get fleshed out a little bit more for us. Interestingly enough, in diabetes, we also see that there is some evidence of some beneficial range for some use of alcohol, which is just fascinating. And then as far as things like certain neurologic conditions, we see it being like fuel to the fire in regards to Alzheimer's disease, for example. And then with a lot of our cardiovascular diseases, we see with hypertensive. So if we have hypertension that's causing cardiovascular disease, we see it having a detrimental effect. But in regards to some of our other cardiovascular or vascular issues like stroke and ischemic heart disease, like heart attack, we see actually some beneficial evidence. So we're going to kind of flesh through that today with you guys. So things that we feel like are really important to consider is, we know that the pattern of drinking is going to affect how the body responds to the alcohol. So are we drinking on an empty stomach, or do we have food there? And that impacts how our blood sugar is being affected by that alcohol consumption. Of course, the volume of the alcohol, like, are we drinking a whole bunch? Are we drinking a little bit? Are we doing this every day? Are we doing this multiple times a day? All of that impacts the severity of the implication for a lot of these chronic illnesses and their impact. We also know from the literature that there is some impact difference for the different sexes, as well as different races and age. So it's not across the board, and that's what makes some of these studies kind of really interesting to dig into and say, okay, there may be some folks that can have a little bit more tolerance than others. Now, as far as type that's ingested, they're going to feel different for the body depending on the type of alcohol and the sugar content, and even some of the other ingredients that are involved in that alcohol. For example, with beer, it has hops in it, which is kind of a depressive agent in general, kind of calming agent in general. And that's going to affect how our neurologic system is immediately affected by this. But when we look at these chronic disease studies, a lot of them really say that alcohol is alcohol. So it doesn't so much matter type for risk increase in a lot of these in a lot of these diseases. Now, the other interesting piece here is that alcohol is actually classified as a class 1 carcinogen. And that's kind of mind-blowing to consider because it's just so socially acceptable. Once again, it's just found in most households in the US, and it's something that we want to remember that it actually does come with a potential price when we're ingesting it. So we know that it takes a severe toll on many cancers, and it's considered to be responsible for about 4% of all new cases of cancer. So, and that study was done in 2020. So kind of recent information there. So, I mean, that is sizable for something that's considered a preventable type of risk for cancer. And then we also know that specifically it's going to affect those areas of the oral cavity that have the mucous membranes involved. So everything, down from the mouth and down, like I was discussing before. And then, of course, the colon and the liver. And then we know breast tissue being particularly influenced by consumption. And usually we're seeing even in moderate amounts of consumption. So we're talking 1 to 2 drinks a day, being implicated for having a higher risk of certain cancers, and that's including breast cancer. So that does just kind of make us really pause and say, hey, this is actually worth paying attention to, and worth really keeping consumption in check. At minimum, considering to keep it in moderation if it's going to be something that we continue to do. So with some of these studies, we wanted to share these with you guys, and you're gonna find that they're kind of broken down into, are they detrimental or potentially helpful, and what do you kind of want to know about how alcohol can affect these certain areas. So we, of course, have been discussing cancer because it's such a big one. And this is the study that talks about that 4%. You see, this was actually done in 2021, that they found similar levels there for being alcohol consumption actually being the cause of these cancers. And we, once again, see that even in light and moderate drinking, that 1 to 2 glasses a day has a contributing factor. So here's an interesting study that looks at breast cancer in particular. And this one's showing that even just a slight increase, so just so you guys can tell here, about 14 grams of alcohol is considered 1 glass. So in this study, they showed that even with a 10 grams, so not even a full glass of increase of alcohol consumption on average daily, puts women at a higher risk of developing breast cancer. And so we wanted to include these study links for you guys in case you wanted to refer back to them. We always try to put our recordings online afterwards, after these talks, so you're welcome to go back and dig into this literature a little bit more if you're interested. So there's pretty specific mechanism that's been really well studied for how alcohol can cause cancer. And this is really interesting to get into because it's not just this change that happens for, say, the mucous membranes. There is, so I'm going to go through these 10 different ways, but basically, we've got a change that can happen because of oxidative stress. So oxidative stress is when the cells themselves get damaged and oxidized, and then they create these free radicals, and at that point we have an imbalance that happens with the immune system, and we need to have tissues that have been damaged be corrected, otherwise we have risk of developing a cancer-like process. We know that it causes inflammation, so that's another one of our mechanisms. We know that it produces this acetaldehyde, which is considered to be toxic for the body and carcinogenic. We know that it can cause changes to our estrogen regulation. And so that's why it's considered to be implicated in some of these hormone linked cancers. Okay. So when we're thinking about breast cancer and things like that, we know that it can cause liver cirrhosis. And when we have this liver cirrhosis, we have an alteration of how the body is able to filter and clean our toxins around us, whether they're internal toxins that we're ingesting or making from excess hormone production to the external toxins that we might come in contact with, like certain chemicals. We know that there is this dysregulation of the immune system that's directly caused by ethanol, by alcohol ingestion, and we know that there is a change with the actual DNA methylation. So now we have changes in what's going on with the genetic information for our cells, and that can affect our cell turnover and implicate um, a cancer byproduct. So alcohol, definitely, very supportive in the medical literature, not helpful for cancer risk. Okay, so we've established that pretty clearly. Then we start getting into some of the literature about alcohol impacting mood. And we know from any time that, maybe personally you've had a drink and you can tell it has a profound impact on mood. For some people, this might be a calming agent. For others, it might be more of a depressant that makes them sad or weepy. For others, it can inhibit some of their normal feelings that would keep them from, maybe socially behaving in certain ways. So you lose some inhibition, of course, with alcohol. And it can have this profound effect long term on our mood regulation in regards to depression in particular. So it's estimated that about a third of our US population at some point in their life deals with an alcohol use disorder. And that's not really a surprise, even though it seems like a very large amount. That's one in three of us folks from the US. Um, and to me, that's not a surprise, just because once again, it is so socially accepted and so prevalent in our society as something easy to access. So we see a much higher prevalence with alcohol use being combined with other drug disorder uses and even tobacco use. And part of that may be because of some of the inhibition changes that are suppressed whenever we are using alcohol. So, maybe you're not somebody who smokes cigarettes, but once you've had a few drinks, you're, reaching for a cigarette or something like that. So our choices obviously are altered by consuming enough alcohol to change our brain state. So as far as mood, we know that that can be detrimental. In regards to cardiovascular research, this one, so just kind of going down going down the line here. So we've got brain, now we're going to heart and to circulation. We know that this one's interesting because there is some research that shows that moderate use can actually be helpful. So it's kind of something that probably needs more research on ultimately. But what we see here in this study is that there's a lower risk of coronary heart disease and heart attack, so myocardial infarction, among the moderate drinkers compared to to those who don't drink at all or drink in excess. Okay, so we know excessive drinking puts us at higher risk of cardiovascular disease. But many patients will come to me and say, well, I was told I was supposed to have a glass of wine a night to protect my cardiovascular system. So it is something where there is some evidence that it does seem to be helpful, but it's considered kind of ambiguous as far as if it's going to be a problem for overall mortality or not, because of the other risks that it can provide for the body. So same sort of situation with diabetes, and there's a chart on the next page that shows something that's called this U-shaped pattern, which we come across in the medical literature quite a bit for this. So it seems to be like with diabetes in particular, to not drinking at all and drinking too much, we actually have higher risk. And so there was a question in my mind when I was coming across this research, like, how can this be? Because to me, alcohol is sugar. That's what it is. And the liver gets impacted by it, and the liver is who's responsible for helping us sort our sugars and making sure that our insulin is working properly, and that's going to affect the pancreas. And I just thought, how in the world would alcohol be helpful for blood sugar? But what we see suggested by these researchers are that a moderate amount of alcohol intake actually helps with insulin sensitivity, which means the receptor sites of the insulin that's responsible for sequestering out our sugar from our blood when we have high amounts of it, say right after we eat our cookie, that actually makes those insulin receptors more receptive and more sensitive. And so that's kind of the theory about why there might be this protective U-shape zone. So this is looking at grams per day. So we're really looking at like 1 to 2 glasses a day for both men and women for reducing risk of diabetes. So thought that was important to share, just because we're hearing all these detrimental components, but there may be some areas that we see some support for moderate use with. Now, as far as how alcohol affects the blood, this is pretty fascinating, because what we know it does to the white blood cells. So remember, white blood cells are our immune system, right? So they're part of our immune system, is that it decreases their production. It really depresses our immune response. So we know overall ingesting alcohol, no matter what type, having it on board in our routine will suppress immune system to some effect. We also know that for the red blood cells, now remember, they're those little cool little donut looking guys that transport our oxygen around our body and help us with our peripheral nutrient transport, specifically with oxygenating our peripheral, like our fingers and our toes and every other tissue in our body too, but especially the far away to reach places from our heart. Those are also going to be decreased. And we know that with excessive drinking, there's an entire type of anemia that can be caused by alcohol. So we know that alcohol starts to affect how the red blood cells are produced, and they start getting produced abnormally, and we start seeing them be too big. And and they also suppress the actual production. So not as many red blood cells to do that oxygenation. And then the ones that are produced are too big and bulky. They're not grabbing the oxygen and carrying the oxygen properly. So that becomes a big problem for circulation long term. And with those megaloblastic anemias, we start to see problems with B vitamin issues and production of the red blood cells the way we want them to be, as far as making sure that they are properly sized to be able to do their job properly. So, and then the next set of blood components that are definitely affected by alcohol are our platelets and our clotting factors. And that's fascinating because alcohol actually can increase our risk of stroke when we look at how our platelets are being affected. And so that's kind of what this study gets into. And generally, we want to be, if we're worried about risk of stroke for somebody, we're really wanting them to back away from alcohol. We wanted to make sure to talk about sleep today as well. Sleep has a is very profoundly affected by alcohol intake. And this might be something that you have personally noticed yourself, that on nights where you have alcohol, maybe you have a harder time initiating sleep, but more commonly people will say, it helps me relax and get to bed, but I don't get the quality of deep sleep, or I have interruption insomnia. So it wakes us up. So what alcohol does is it actually affects the electrophysiology of the sleep architecture. So that's fancy words for basically saying that it keeps us from getting into the deep REM sleep. So that rapid eye movement sleep, where we're getting that really truly restful sleep that helps our brains have the recovery time that they need. And specifically, it affects that REM sleep in the first half of the night. And we see that there's a decrease in total REM sleep at high and even moderate uses of alcohol ingestion. So there's many studies about this. This is just one that was pulled from 2019 for you guys. And this one was kind of nice because they talk about how it affects and triggers insomnia, how it affects deeply the circadian rhythm. And that's a big deal, right? That's our wake and sleep cycle. And that circadian rhythm impacts almost every single cell in our body. Having that disrupted alone, we know, supports more of our aging process and our degeneration inflammatory process and our cancer risk. So we really don't like to mess with the circadian rhythm. So we see that in healthy adults, with a moderate alcohol consumption, it really does affect that, what's called the diurnal, so twice a day, body temperature regulation change that happens with the circadian rhythm, and it affects our melatonin levels as well. And there's even a term, social jet lag, which is basically this like short-term sleep deprivation that is caused by, alcohol and ingestion. So we can throw our sleep cycle off even just with short-term use of alcohol, but by certainly having chronic daily alcohol coming in, it's going to affect our melatonin levels, our cortisol levels, and our wake and sleep cycle and the depth of that sleep. We also know that alcohol really increases our risk of apnea. So it really increases our risk of the snoring and oxygen deprivation during sleep. And it can make pre-existing problems in that area for people worse. And so, of course, if we're having sleep apnea, we're not getting the oxygen to our body while we're sleeping. And so we're actually having a lot of secondary side effects from that, not just waking up feeling more fatigued, but we can have some cognitive mood changes, even things like high blood pressure pressure can be a side effect from that, and certainly increased risk of cardiovascular damage from not getting that deep sleep. So alcohol is detrimental to sleep, even if it makes you feel like you can get to sleep better and relax more at the end of the evening. I hear that quite a bit. "Oh, I'm just going to have my glass of wine because it helps me get to sleep." It's actually not great, later on in the evening for us. And a lot of my patients are pretty shocked when we finally get them off of that evening routine of having alcohol every night to induce sleep. All of a sudden, they're actually able to have better quantity and length of sleep duration. So that's always a really gratifying thing to see for people, and just has such a profound ripple effect for their overall health. So it's a really good reason to want to think about moderating alcohol intake and not using it as a daily agent. So then we get into alcohol and the immune system, specifically in regards to the microbiome. And I just felt like we really needed to include this here. With my background in cellular and molecular biology, I kind of can't help myself. The microbiome just has such a profound impact on our well-being. And this is something that Dr. Rosalie and myself are often talking about with patients, getting their microbiome back in balance so that they can have a healthy immune response. We know that about 70% of our immune response is down in that gut associated lymphatic tissue in the GI, and that is regulated by our gut flora, so our microbiome. So our good healthy bacteria and other microbes are all part of that balance. So we know that alcohol sanitizes things, right? Here we just all lived through the pandemic. We used hand sanitizer aplenty during that time, right? So we do that. Why? To kill microbes. Okay. So we know that by ingesting alcohol, that alcohol is going through like a sanitizer to our gut. So take a second and just think about how that can have a very profound effect. So even before getting into this medical literature, you could see how using this antiseptic agent, the sanitizer, and ingesting it can have a very powerful, potentially very harmful effect on our microbiome. So what this study did was it said, hey, we already know that alcohol can lower white blood cell count overall. We know that it has that impact. But what's it doing on the microbiome, and how does that work exactly, that it's affecting the actual environment of our gut? And we, are often really focused on the microbiome, once again, being mainly in our gut. And when we think about alcohol use, once again, it's just going to be going right through those areas that are just so colonized with our good guys. So what we see in this is that alcohol has a few different disrupting mechanisms that it does, but one of them is that it affects this intestinal barrier integrity. So what that means is, in between our colonocytes, those lower intestinal cells, we have different um, different proteins that help keep these sealed. And one of, or several of them, can be disrupted in that process. And we can do damage, of course, to the cells themselves, the colonocytes themselves. But we see that the integrity of this lining becomes compromised whenever alcohol is introduced, especially in more chronic drinking or more continuous drinking states. And that's because we have this damage to these membranes. And so we get more permeability. So more things leaking through in between these cells than are supposed to. And when that happens, our microbiome gets disrupted. So those little cells that I kind of like to think of like the cherries on top of the icing that's on the cake, which is the cell walls or the cells themselves. And we can get proteins that we don't want to have come through, microbes that we don't want to have come through because we have more permeability of the gut than we're supposed to. So alcohol can be very erosive in that way. So here's kind of a picture, and it shows here that as we're inducing the alcohol and it's being picked up from the gut, taken into the portal vein, taken up to the brain through our circulatory system, we have all these inflammatory markers like the cytokines that increase. You guys have heard of cytokines now, especially with COVID. People talked about the cytokine storm. This is one of our inflammatory immune responses. We have TNF alpha, also another inflammatory immune response. So all of these increase, okay? And that means, of course, as a secondary side effect, we have things like neural inflammation that increases too. And this is a fascinating piece because the gut barrier seems to be in parallel with the brain barrier. So if the gut barrier is disrupted and we have what's called leaky gut or intestinal permeability that's excessive, more than we're supposed to, and things are leaking in here from the bloodstream past where they're supposed to be, then we also have a much higher risk of the blood-brain barrier. See that BBB? That blood-brain barrier also loses its integrity. So that means we have inflammatory markers, these cytokines, toll-like receptors, NF-alpha, all circulating through the blood, getting into the brain. So that's the impact that we see when we were talking earlier about things like Alzheimer's, dementia risk going up. So alcohol is very concerning. If we're worried about cognitive changes, alcohol is something that we need to seriously consider getting a handle on or reducing as much as possible, in my opinion. And so when we're thinking about it with the gut, once again, we see this alcohol coming in and these tight junctions between these cells getting less tight. We lose that. We increase that permeability. That means things leaking through of that barrier protection. And then we also increase certain types of colonization of bacteria that we don't like. And then there's a marker that we often are checking with our patients, with that we're worried about major inflammation with, called LPS, that gets released into the bloodstream. And that's a marker that shows us that we have this intestinal, typically, inflammation going on. So that's a great segue into how our microbiome and our gut are connected with our brain. We just talked about that blood-brain barrier becoming more permeable and things passing through. And that's a big concern because, especially as we go through life, we may come across a virus, bacteria, even like having a urinary tract infection or something like that. And all of a sudden, if we have a blood-brain barrier that's permeable, we have the potential for those inflammatory markers to pass through, and we have neural inflammation. And that neural inflammation is very hard to turn off. Once it starts signaling, we have these cells that don't know how to turn off in the brain for inflammation. And these macrophages in particular can do a lot of damage to the brain and the cognitive tissues up there, so the neural tissues up there. So we want to take that pretty seriously if we're worried about, once again, the brain at all. Alcohol needs to be seriously thought about. Now, as far as this study goes, it essentially is showing that alcohol itself can induce neural inflammation. And that should, also make us pause. So this is more than just that connection between the gut and the brain. This is looking at all these inflammatory cytokines, again, these inflammatory chemicals that the body creates, just because of that alcohol presence. Okay. So we know from this that there are all these reactions that happen at a cellular level in the brain that can be damaging it. And what that means for us is neural inflammation results in a few key changes, symptoms that we see with our patients. Fatigue being huge, mood changes being huge. So that's like anxiety or depression. And then, of course, recall and cognition, brain fog, memory changes being very concerning. Okay. So it becomes pretty serious at that point. So we always like to take a pause whenever things are affecting the brain. So this is this big question, of is there a healthy amount of alcohol? So today, we look through this literature and we see a lot of negative marks for alcohol at just about any level of intake, which is kind of a bummer because it can be enjoyable to have alcohol with friends and family occasionally in moderation. But now we also see on the other side that there are some studies saying, hey, there's some benefit here for certain cardiovascular reasons, for certain, things like diabetes, for blood sugar management. But they do seem to be in this narrow window of low to moderate ingestion. So this study that was done, they took a long period of time to do it, and they pulled it from 195 countries, found really that the level of consumption that minimizes health is loss is zero. So that's a pretty stark recommendation, saying like, really, if we're looking at minimizing health impact, the answer of how much should we be ingesting alcohol is zero. And that's a pretty, yeah, stark kind of line to draw. But that's what these researchers kind of came to the conclusion of. And part of that has to do with the fact that alcohol is classified as a group 1 carcinogen. I mean, that's pretty major. So it is something that, when we talk with our patients, we always want to see where people are coming in at, and really supporting them where they're at. And it may be something that we work with them to find certain levels of moderation that they feel like um, are worth some of the risks for them. And I think it's becomes a very individualized conversation in regards to what's going on in a person's life in regards to their social aspects, their family aspects, and also in regards to their own health risks. If they have high risk of breast cancer, for example, probably, recommending not drinking at all is a very valid option for them. But we do like to, really individualize this, and once again, be supportive, because we know that this is not easy, especially if alcohol is something that's coming in every single day. No part of um, getting that out of a routine is easy for most people. So it's important for us as doctors to step back and say, let's look at the whole picture. There's usually some service that's being provided by alcohol consumption for our patients. So that's one of the beauties, for me as a naturopathic practitioner, is I get this wonderful privilege of being able to sit with my patients and get to know them. And, with our new patients, we're spending an average of 2 hours talking to them and getting to understand what makes them tick, what they like to do, what their motivations are, what their goals are, and understand what stressors and life lifestyle balances they have and ways that we can really reduce their overall stress, but increase their body's internal tolerance to stress because life is stressful. So when we do that, we're trying to identify if we see that there's an issue with alcohol or if they're high risk for some of these conditions that we know alcohol can be really damaging um, for, then we're trying to figure out what purpose that alcohol is serving, and we're trying to come up with ways to support that in other ways. And often there is this link with one of our neurotransmitters, which is the reward system of dopamine, that we get whenever we drink. We get a little dopamine bump. And that is something that we're usually trying to address with people. And in fact, in just a minute, I'm going to be inviting you guys to our next talk, which is going to be all about dopamine. But this is just a time for us to remember that self-care is critical. It is not selfish. It is something that we need to be including on a daily basis, and that might look different for every single individual. And part of that is really prioritizing things like our sleep and things like our healthy eating habits, making sure we're having our square meals and that we're well hydrated. And by doing those foundational pieces, a lot of times we don't have the same cravings and urges that we may have for some of those neurotransmitter stimulators, like those dopamine urges that we may have. We need to be thinking about what we're doing for our stress management in regards to whether that's practicing a gratitude practice, journaling, or meditating, or singing for fun, or just calling and connecting with a loved one, or spending time walking in nature. Whatever that looks like, those pieces may be very fulfilling to you or a loved one that might be using alcohol to either mask something that's imbalanced or that they're not having fulfilled in other places. So we just want to say that it's really important to look at the whole person and figure out what we can do to help regain that balance so there's not that chronic search for the reward system to be fulfilled. We also just want to remind you, because here we are with the holidays just a few weeks away, really, that during the holiday season, it can be very, very important to look at stress management. We know we go through a lot of B vitamins in particular when we're dealing with excess stress. And alcohol consumption in particular is known to really blunt the absorption of our B vitamins. It's one of the reasons why we can get alcohol induced neuropathies where people, it's called the stocking glove syndrome. So they lose their good sensation, or maybe they'll have numbness and tingling of their hands and feet. And it has to do with those B vitamin levels being low. So just wanted to circle around as we're talking about self-care and remind everyone that sometimes holidays can be particularly joyous and sometimes they can be particularly stressful, and to make sure that you're doing things to support against those stressors other than reaching for excessive amounts of alcohol. So our next doc talk is going to be on Thursday, the 14th of December, and that one's going to be all about dopamine. So remember, dopamine, like I was just saying, is that neurotransmitter that is our reward system for the body. So it feels like a little chemical reward for our body. So there's so many different ways that people seek dopamine. You can see this like skydiving here. So it can be a thrill seeking thing. It can be, we talk about drugs, sex, and rock and roll all being within the dopamine sphere of the reward system. But there are other things like exercise and other ways to support that system. And we'll be discussing that then. So please make sure to sign up and join us for that. And then I want to also just invite any of you who feel like they need extra support in this arena, particularly with alcohol cessation, stopping or reducing or changing your pattern of alcohol intake. That's something that we love to do with folks. And, especially when thinking about how much preventative impact we can have for this with simply reducing alcohol intake or eliminating it completely. It's pretty darn significant, as you guys have all seen today. So we're here. If you need us, feel free to jump on our website and request an appointment that way, or even a little meet and greet consultation if you're new to us, or give us a call. Our staff is happy to help you out with that. And even if you just haven't seen us in a long time and want to do a brief check-in, if this is something that's going on for you, we're here to support you in this, because this can make a pretty darn profound impact in overall well-being and health long term.